You know that feeling when you wake up tired, even after a full night's sleep, when you push through your day running on empty, wondering where your energy went? Here's something most people don't know, that fatigue may actually be happening inside your cells. That's why I've been using anti-factor lipids powder from Nutritional Therapeutics for years. I don't go a day without it. It's based on over 20 years of research and a patented process called membrane lipid replacement, which actually repairs the damaged components of your cell membranes, restoring your cell's ability to produce energy the way they did when you were younger. Clinical studies show anti-factor can reduce fatigue by up to 40%. Just 1 or 2 scoops a day. Mix it in a smoothie like I do, sprinkle it on food, and you're giving your body the science of youthful energy. Anti-Factor Lipids Powder comes in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to antifactor.com. That's antifactor.com for Anti-Factor Lipids Powder. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's our weekly opportunity to answer your questions. Take advantage of this resource by sending an email to questions@drhoffman.net. That'll be fodder for our discussions going forward. With me today is Leyla Muden, who is our resident nutritionist. And so we have a question, Leyla, right? And
we do.
Just without all the background. I mean, this guy is like had a lot of wear and tear in his body. He's been, like a UPS delivery,
package delivery.
And I got to say, there really is something about physical labor that grinds the body down. We talk about exercise,
absolutely,
but
overuse.
And again, I'll refer to this book that I was reading. It was called Lost Worlds, and it's a book about archaeology. And when they look at people in certain cultures, they find that when there is a lot of physical work, like especially around like monuments, like the pyramids, these ziggurats of Mesopotamia, these like terraced pyramids, and these incredible monuments, they look not at the royalty, because the royalty, they have other problems because they're eating, they're having too much sugar and luxurious goods, and they actually have coronary heart disease in the mummies. They can do MRIs and they can see, because they're eating high on the hog. But then they look at the workers, and the workers to some extent suffer malnutrition.
Yeah.
They suffer developmental problems because they're not getting enough food. They're short in stature, but they also have evidence of repetitive stress injury to their joints and sometimes vertebral fractures because they're carrying heavy loads. And, I know some of the UPS workers, and I know actually people, who work with me, people from their family who work for UPS and other delivery services. And they often have repetitive stress injuries. They have knee problems. They have back problems because it's a wear and tear thing. Yeah. So that is real. That's a real thing. All right. So coming to the question about, glucosamine, glucosamine, I think, is something that offers the prospect of preventing, to some extent, the destruction of the synovial membranes and destruction of the collagen that essentially cushions our joints.
Yeah.
However,
and he's had meniscus tears in both and surgery in both knees.
And here's the other thing. If you look at the knee of the average 60-year-old with an MRI, there will be a meniscus tear. If you look at the knee, at the hip of the average person who's 60 or 65, they will have evidence of labrum tears. It is not, it's like acne in a teenager. It is the rule rather than the exception. Yeah. And so merely having that doesn't mean that you need to have a knee replacement. And with the right kind of physical therapy, often you can overcome that. Because what's the alternative? I mean, you can put filler in there. There's genicular artery embolization where you kind of zap the arteries that feed the nerves there, and you can reduce your knee pain, but that doesn't really help your cartilage. So I
Yeah.
think glucosamine is a good bet with chondroitin,
Great.
and maybe
Yes.
also collagen. Just take
Yeah.
good
And
source of collagen.
MSM too.
MSM too.
It
Yeah.
used to be the trifecta of
Yep.
glucosamine, chondroitin, MSM, and collagen, and lately came on the scene.
But
Right?
I'm going to say that there's a modest benefit to that, and
Mm.
eventually there it's kind of a natural process of wear and tear. Now, what you want for your joints is you want the sweet spot, because it turns out that you get more joint deterioration if you're sedentary. And
Hmm.
if you're like an ultra marathoner, or if you were, a UPS delivery person, carrying heavy packages, you know, you're going to have, or, a longshoreman, you're going to
Uh-huh.
have more. Although longshoremen are pretty sedentary now, they just basically work robots, and they don't do the lifting that they used to do.
True. True.
They work crane operators and that kind of stuff.
Hmm.
Uh, but so you want that sweet spot in between, and that's one of the reasons why I've kind of rationed my running,
Mm.
because I think that it is the rare individual who can successfully run consistently past the age of 70. So
Ah.
more of my exercise is strength training, swimming, and floor
Yeah.
exercises and
Yeah.
stretching, uh, and
Terrific.
yeah, and cycling and
And
cycling
cycling.
cycling puts pressure on your knees, no question, on your hips, but it
Hmm.
is less jarring.
Right. Right. Exactly. You're not pounding. You're not
Yeah,
pounding pavement, so to
yeah,
speak.
and
So
again,
that's important.
the pavement is not very yielding, and my opportunities for running are mostly in urban settings, and so yeah.
Hmm. Right. Right. And it's not like you could run on the road in Manhattan on the street where the tar is maybe a little bit softer than the concrete, but still not great.
Yeah,
Not
it's
great.
not like running on a cinder track or something like that, or on
Yeah.
turf. Um,
Hmm.
so, I mean, and just apropos of that, there's a little bit of a scare story now about glucosamine, about how glucosamine can cause cognitive decline. Uh, Please read my article, which I
Yes.
wrote a couple of weeks ago, and it's available at drhoffman.com, which is a takedown of that study,
Hmm.
because I think that it's a bit of a reach to think that glucosamine can cause cognitive decline. If you have Alzheimer's disease, perhaps you may not want to take glucosamine. Look, you got bigger problems than your joints if you've got
Yeah.
Alzheimer's disease.
Absolutely.
You want to take all these. You want to take cognitive supplements if you have
Yeah.
Alzheimer's
Yeah.
disease. And there's a limited amount of supplements that a person with Alzheimer's can swallow. They even have swallowing problems. So,
Yes.
you know, maybe stay away from the glucosamine until
Right.
we have sussed this out better. This is just one
Hmm.
study that points to the potential for harm. And
Hmm.
by the way, they looked at normal individuals, and they looked at normal rats, because it was a rat model of Alzheimer's disease, and they could find no changes associated with glucosamine exposure.
Yeah. Yeah.
So
So.
for ordinary folks, this is not a concern.
Hmm. Hmm. Is there a sweet spot dose that you like, Dr. Hoffman,
Well, I think it's
for
like 1,200 or
glucosamine
1,500 of glucosamine
a day?
with 600 or 800 of chondroitin. These are usually combination products.
Yeah. Yeah. Okay. All right. So, Tom, there you go. All right. Best of health to you. Okay. We've got a question here from Mary. Mary is asking, can you talk about oral versus IV chelation? How do you know when to do oral? Is oral enough, or is IV chelation often recommended? And for what? Like, say somebody has a high mercury level due to eating a lot of swordfish
Mm-hmm.
or tuna. Should they undergo IV chelation? Can they
Right.
just undergo oral chelation therapy?
Well, let me just tell you that the first time I saw intravenous chelation with EDTA was well before I was an integrative doctor. I was doing a rotation in pediatrics at Bronx Lebanon Hospital,
Mm-hmm.
which is in the heart of the South Bronx. It's
Yeah.
really in a very, what was then, Fort Apache, the Bronx is burning, like a very
Yeah.
uh, impoverished neighborhood. And the problem that they had there is they had deteriorating housing stock, that had old lead paint, and it turns out that kids who are malnourished, who have poor diets, have a condition called pica, and pica
Oh, yeah.
is we see it throughout the animal kingdom.
Yeah.
Is that animals, when they're deficient in minerals, they'll eat dirt, they'll eat pebbles, and when humans have a deficiency in minerals, they will pick up paint chips and eat them.
Mm-hmm.
And the paint chips were loaded with lead. And so we had these young kids, mostly minority kids,
Yeah.
who would come in diagnosed with lead intoxication,
Mm.
very high levels of lead. So give you an idea, like, I get worried when somebody has a lead level of, 8 or 10 or 12.
Sure.
These kids
Yeah.
had lead levels 60, 80,
Mm.
very high levels.
Mm-hmm.
And that is associated with intellectual impairment as you
Sure.
grow up. And it's also associated, it's been to some extent associated with a propensity to violence. So,
Mm.
they also, even historically, they say that the Romans used lead pipes because lead is very, plumbing comes from the word lead. Plumbum is the word
Lemon.
in Latin, lead.
Oh, yeah.
And so,
PB.
right.
Yes.
And lead is very malleable. And so the Romans made their plumbing out of lead. Little did they know that they would
Wow.
spawn crazy emperors like Emperor Nero, who fiddled while Rome burned. And this may be part
Yeah.
of the deterioration of the Roman Empire because they were poisoning themselves with lead. They also liked leaded wine. They thought lead
Oh,
imparted a nice flavor to wine.
oh
So
boy.
anyway, so this is a circuitous way of saying the first time I was doing rounds in pediatrics as a
Hmm.
young medical student, and I saw a bunch of kids hooked up to IVs, and I said, "What's going on in there?" And they said, "Well, they're getting chelation for lead,
Wow.
getting chelation for lead with EDTA." Now, fast forward, a few years later, I graduated medical school. I did my medical training. I went into practice, and I
Hmm.
learned that EDTA chelation therapy could be helpful for circulation and cardiovascular disease.
Yeah.
And I became the president of the American College for the Advancement of Medicine
Yeah.
eventually.
Yeah. Hmm.
And this was an organization that promoted chelation as kind of its flagship therapy. And we
Yeah.
actually did a study with the National Institutes of Health. It's called the TACT trial. And it showed
Hmm.
promise for people who had had a heart attack, who had diabetes, that it actually reduced the incidence of subsequent heart attacks, diabetes.
Wow.
However, in a follow-up study, the results were kind of equivocal. So
Hmm.
it really wasn't so much a slam dunk for cardiovascular disease. And it's an unwieldy treatment because you got to sit there for 3 hours. You got to get
Yeah. You're
30,
there.
40 treatments. It's not covered by insurance.
Hmm.
But what I have to say is that whether or not it conclusively, because I've seen it really help people with claudication, which claudication means you can't walk to the mailbox without experiencing excruciating pain in your calves or in your thighs, poor
Yeah.
circulation. And I've seen that enable people to walk, miles and miles after a
Hmm.
series of chelations. It really seemed to open up the arteries. But that
Hmm.
was not tested intact. They did not look at claudication. But what I
Okay.
will say is that intravenous chelation with EDTA, if you have a high lead level, it's the most effective way to get rid of that lead. That lead is not
Hmm.
good for your brain. It's not good for your arteries. It's not good for your
Yes.
body. So, as a cleanup, I mean, I personally uh, took chelation therapy
Hmm.
to rid myself of the lead. I'm a kid, grew up in the 50s and 60s. They still had leaded gasoline. So we were all
Yes.
exposed to lead. And
Right.
so, most baby boomers, because the regulations weren't as stringent, we were exposed more to lead. I
Hmm.
got the lead removed.
All
I got
right.
the
You
lead.
got
I got the
unleaded. You
lead
got
out.
the lead out.
I got the lead out. All right. So that's intravenous.
Yeah.
So oral there's a couple of medicines that are target. Oral EDTA doesn't work. Doesn't do anything. It's a waste of
Mm-hmm.
time. Just a waste.
Hmm.
Uh, Oral DMSA targets both mercury and to some extent lead.
Okay.
Oral D, it's DMPS is
EMPS.
a
Okay.
little bit more targeted towards mercury, but it's a little bit more of
Hmm.
it can be given intravenously, you can give it orally, but you got to be careful. And these are prescription drugs.
Right.
So I used to do, some oral chelation, a lot of intravenous chelation. If you get tired of doing the intravenous chelation and you still have high mercury and lead levels, you can use the oral.
Oral
Now,
chelation. Yeah.
you know a little bit about some things like cilantro, various things that also
Maybe,
have
yes, cilantro is very detoxifying for the liver, things like that.
but not
Horseradish.
just for the liver, but it actually seems to target mercury
Yeah,
because
well,
it has sulfhydryl groups. I think garlic also
right,
does that.
right. Chlorophyll. And there's a supplement called Metalloclear,
Okay.
which can be helpful for oral chelation. You take
Right.
it for a period of 6 months or so
It
and get
it's
your
it's not
levels
as
checked
it's
again.
not as strong. It's very
No,
safe to use.
yeah, yeah, exactly. Whereas with IV chelation, you need
So
supervision and so
I
forth
think
and
that
so on. But
we're
yeah,
all exposed to toxins.
we
We're
are.
exposed to microplastics, we're exposed to chemicals, we're exposed to heavy metals.
Yeah,
So as part of a detoxification protocol, if you really want to optimize, consider getting your levels checked, and then you can undertake IV chelation if you have the time and the commitment to do it and money, or you
absolutely.
can ask your doctor. And the integrative doctors do this because conventional doctors, they look at levels and they go, well, you're not in the toxic range. You're not like these kids who are getting, who ate lead paint chips. Your levels, 10, 12. It's like, it's no biggie. Uh,
Hmm.
but,
Hmm.
I just think that, lead belongs deeply underground, not in your body.
Right.
No lead level is really a safe lead level.
Yeah.
Um,
Yeah.
so
Okay. Mary, there you go. Thank you for your question.
shall we
All right.
pause now to allow one of our sponsors an
Yes.
opportunity to share a message with our listeners, as we customarily do? They are what underwrite this program, and we select our sponsors very carefully. So listen up. Here goes. You know that feeling when you wake up tired, even after a full night's sleep, when you push through your day running on empty, wondering where your energy went? Here's something most people don't know, that fatigue may actually be happening inside your cells. That's why I've been using anti-factor lipids powder from Nutritional Therapeutics for years. I don't go a day without it. It's based on over 20 years of research and a patented process called membrane lipid replacement, which actually repairs the damaged components of your cell membranes, restoring your cell's ability to produce energy the way they did when you were younger. Clinical studies show anti-factor can reduce fatigue by up to 40%. Just 1 or 2 scoops a day, mix it in a smoothie like I do, sprinkle it on food, and you're giving your body the science of youthful energy. Anti-Factor Lipids powder comes in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to antifactor.com. That's ntfactor.com for Anti-Factor Lipids powder. Ever walk into a room and forget why you're there? Lose your train of thought mid-sentence? Feel like your brain is running on fumes by 2 in the afternoon? Try Kyolic Specialty Series Smart Mushrooms Plus. This isn't caffeine. It's not some jittery stimulant that crashes you an hour later. This is a clean, science-backed formula built around certified organic lion's mane mushrooms, clinically shown to support the nerve growth factor that actually helps your brain maintain and organize neurons. We're talking real foundational support for focus and mental clarity, and it doesn't stop there. It's combined with Kyolic Aged Garlic Extract, aged up to 20 months on organic California farms, plus Aronia Berry Extract, selenium, and vitamin B12 for long-term brain health and executive function. 2 capsules with a meal, once a day, vegan, non-GMO, no gluten, no dairy, no artificial anything. Kyolic Smart Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening. Thanks for supporting our sponsors. They're what make intelligent medicine a genuine free resource to you. And now back to our questions. What's next, Leyla?
What is the importance of nitric oxide? How can I help boost my levels? This is from Charles of
Okay.
nitric oxide. Is there a supplement I should take? Is there something I should eat? And how important is it?
Yeah, so nitric oxide is ubiquitous within the body.
Yeah.
The
Our
type,
body makes it, our
right.
microbiome makes it to some extent, but
Yeah.
it depends on the extent.
Yeah, the name ubiquinone and ubiquinol went to CoQ10 and ubiquinol. But
Yeah.
it's kind of a cool name because it means it's everywhere. But nitric
Yeah.
oxide is a chemical messenger everywhere in the body. So it helps to dilate arteries, which
Hmm.
lowers blood pressure, promotes circulation. It's responsible for erection in men.
Hmm.
And to some extent,
Hmm.
there's less plumbing in women, but
Yeah.
there's some, component of nitric oxide in terms of
Yeah.
sexual response. It's responsible for, athletic performance to some extent. Many athletes take
Yeah.
nitrate supplements.
Hmm.
And on and on it goes. So there's just so many benefits. There's even skin benefits to topical nitrate products. So
Hmm.
I've looked at this for a long time. We had a sponsor once, which was a beet product,
Yeah.
and that's a popular product. But the guy who really is the guru of nitric oxide is Nathan Bryant,
Uh-huh.
and we actually I sought him out because I said, look, you're making like a really great product here. You have a story to tell. I would love to partner with you to get the message out because I think you really understand the science. And it's not just a matter of taking beets and drying them and putting them in powder and putting them in a capsule.
Hmm.
And you actually, and he's pretty transparent about um, how he uh, jazzes the potential for nitric oxide to be produced in your body
Hmm.
from these supplements. And so his product's called N101,
Uh-huh.
N101, and it's not
N101.
N10 with an O,
Yes. Yeah.
uh, letter O,
Yeah.
N101. And I don't have this offer there, but if you hear some of our spots on it, I think there's a special offer for intelligent medicine listeners to try the product and see how
Yeah.
you feel. I
Hmm.
take the lozenge before workouts,
Mm.
and it might be a placebo effect, but I think my workouts are really great,
Yeah.
and
Yeah.
so
There are benefits for normalizing blood pressure for
sure,
people who may be in
absolutely,
pre-hypertension,
absolutely,
and
absolutely.
yeah, you could get it absolutely through these supplements. Your body makes some, your microbiome. There are ways to decrease your nitric oxide, which is not a good thing.
Yeah.
Using mouthwash may
he
be
talked
one of
about
them.
he talked about he said he actually
Yeah.
authored the paper which is about
Oh,
how the
okay.
oral microbiome
Yeah.
has an impact on nitric oxide production, and if you kill
Hmm.
off all your oral bacteria you won't get a successful transformation of dietary nitrates to nitric
Yeah.
oxide. What you're getting in the pill, you're not getting nitric oxide in the pill. Nitric oxide is gas, and it's
It's a
actually
gas.
very ephemeral. It appears for like a millisecond as
Yeah.
in your bloodstream and in your cells.
Hmm.
And so you can't take like a nitric oxide pill. You can take
Right.
nitrous oxide, which is laughing gas at the
Right.
dentist.
At the dentist.
Yeah.
Right, right, right. And there are other plant foods that promote nitric oxide production.
Yeah.
Celery comes to mind. A lot of people who are concerned about their blood pressure, for example, are drinking some celery juice,
Mm-hmm.
when they get up in the morning. But many of the dark green leafy vegetables,
Do you
your
remember?
broccoli,
Do you
your
remember that thing,
watercress.
celery soda? You remember that?
Yes,
You
I
know,
do.
I
I
grew
don't
up
think
on
I've
the
ever had it.
I grew up on the West Coast, and it
Uh-huh.
was a regional thing. It really was kind of a like a New Yorky Brooklyn thing, and
Uh-huh.
it never made it to the West Coast. And then I came to New York. It was like celery soda. It was like,
I've seen it. I don't
yeah,
think I've ever had it.
yeah.
Hmm.
Well, okay.
Okay. All
So
right.
that dates me, I think. So, uh, uh, arugula, which
Arugula.
I so I have a
I
habit of
love
making
arugula.
arugula with beet salad, fresh
Mm.
beets,
Hmm.
and I'll sprinkle some goat cheese on that, and maybe some
Lovely.
walnuts or something, and
Lovely.
yeah, and that's just a yummy salad. I find that when I eat that, I also it takes a little bit the edge off my appetite, so I don't chow down as much for dinner.
Right, 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 right. That's a nice starter course,
Yeah.
right? So, okay. Charles, thank you for that very thoughtful question. Okay. Oh, and we've got one here from Mark. Mark is asking, I'm going in for blood tests in a couple of weeks, and are there any supplements I should stop taking before
That
going in for
that
blood tests?
that's a really good question. And so let's look at what if you took like some B12, or if you took some vitamin D right before the blood test, like the morning of the blood test, like would that throw off the blood test? Well,
No.
I mean, hypothetically, you might have like a false elevation of some of these things for a while in your bloodstream, but I wouldn't
Okay.
worry about that. I wouldn't
Yeah.
worry about that. Or
Okay.
vitamin C or, something. But
Yeah.
mostly you're not going to get tested for those.
Or even the the other B vitamins as well.
Yeah.
Absolutely.
So
Hmm.
that's not an argument against taking your vitamins
No.
before a blood test, but there is a vitamin that is in the B vitamin family called
Yeah.
biotin,
Hmm.
which some people take really high doses of, especially because they're worried about their
Hair loss.
hair and nails. And
Yes.
and biotin is known
Healthy
to,
hair, skin, nails.
yeah,
Absolutely.
yeah. And
Yeah.
biotin is, and at very high levels, we're talking, in a multi, you might get, I don't know, maybe a few micrograms. You might get 5 milligrams in a
Hmm.
supplement. That's like, 100 times more potent than what you get in a multi. I think you get
Right.
like 50 micrograms in a B complex or in a multi.
Yeah.
That will throw off certain hormone tests,
Hmm.
especially thyroid tests.
Yes.
And
Yes.
so do not take that right before. Now, the question arises, how long before should you stop?
Mm.
And since biotin is water soluble and doesn't
Hmm.
accumulate, I would say 48 hours is enough.
48 hours. I'm a
40,
little more conservative. I
yeah,
tell
okay.
everybody to stop taking it a week before,
Okay.
pretty much.
You're
Just
not going to
because.
you're not going to go into like biotin deficiency if you
Exactly.
stop your
Exactly.
right.
And Dr. Hoffman, they're not just relying on the amount of biotin in their multi, but they're taking like 10,000 micrograms,
That's
10
right.
grams
The extra
of
amount
biotin. That's a
that's a
lot.
separate dose because there's going to be
Yeah.
a little in your multi that may or may not compromise the test. But just be safe on that and
Right.
don't do that because it could confuse your doctor. All right.
Exactly.
The other one is a popular supplement that I think is great.
Everybody thinks it's great.
Creatine.
Yeah.
Love creatine. I take it.
Hmm.
I think it's good hedge against sarcopenia. I've actually put on muscle weight. The way I can tell is my scale broke. I had a scale
You
and
broke your scale.
it's like a cheap scale that I had, one of the electronic scales. And I got on it one day and it was like, all of a sudden it became like a very complimentary scale. Like it
Uh-huh.
complimented me like, oh, great. It's like, wow, I lost 15 pounds. Like amazing.
Uh-huh.
No, it was broken. So I had to get rid of it. But I should have put it up on eBay because it's like, for a lot of people, I'd be like, man,
They love to see that. Yeah.
this is cheaper than Ozempic, or Mounjaro. Because I just jump on the scale.
Break your scale.
Yeah, it was inaccurate, but
Uh-huh.
in a good way, inaccurate. Anyway,
Mhm.
so they got this new scale. I decided to get a scale that gives me body composition, and it gives muscle. Like in the office, we had a body composition
We
machine.
did. Yeah.
In the early iterations, they cost hundreds and hundreds of dollars.
Yeah.
They've actually got it down to consumer scale. I think I paid 100 and change for it. So I
Yeah.
stand on it, it gives me my weight, but it also breaks it down into your fat weight, your
Yeah.
muscle weight, and it even gives me an approximation of my visceral fat.
Oh,
And
wow.
from that, I can see
Mhm.
that my strength training is working out because as I gain weight, it's not fat weight, it's actually muscle weight.
Right. And
Uh,
reminder to everybody, don't be thrown by the number on the scale. Muscle weighs more than fat. If you're gaining muscle, you are changing your body composition for the better.
yeah.
It's a good thing, especially as we get older.
Yes, because you actually want the little muscle reserve because stuff
Absolutely.
happens. You might have an
Mhm.
accident and that's going to just suck you down if you don't have good muscle. Or you might have an
Yeah.
illness, an infectious illness, or God forbid, you have a serious diagnosis or you have an operation. It's
Yeah.
not bad to have a little bit of a muscle reserve.
Absolutely.
So on the BMI, like I'm going, 25, which is kind of the cutoff for overweight. But
Mhm.
BMI doesn't really distinguish between,
It does not.
yeah,
BMI is not great
yeah.
as a
So,
measurement. Mhm.
if I would recommend one of those scales,
Mhm.
and this is not a commercial, but the brand I got is a Withings scale,
Mm.
Withings. I got the cheapest one because there were others that it looked like they were going to give me too much information,
Okay. Yeah.
and so, you know,
It was going to tell you your horoscope and
you're right.
what's going to happen.
It was going to give me like the Dow Jones and the NASDAQ.
Wait, we'll take that scale.
It's like
maybe the lottery numbers.
It's sorry, you gained 3 pounds of fat, but your portfolio is is up 4%.
Good.
Yeah.
Your portfolio is good.
Right.
Oh my gosh. All right.
So anyway, yeah, that I think is it. That's pretty much our mailbox, and we're also kind of hitting our.
Thank you, Mark, for that question.
Our biological clock is ticking, and we are out of time.
I want to remind everybody, questions@drhoffman.net is the place to go. We really love hearing from you, not just questions, but comments or topics of interest that you'd like to hear us take a deep dive on. And don't forget that you can shop hundreds of curated vetted supplements in Dr. Hoffman's full script dispensary. Go to drhoffmanstore.com. Through Full Script, you can access all of his custom protocols that combine products that he recommends to help you achieve your specific health goals. Begin with a starter kit. Then you could go on to expand with additional protocols for your health concerns, maybe allergies, maybe your bone health, brain, detox, immune, sleep and stress support. Remember, go to drhoffmanstore.com. That's drhoffmanstore.com.
Okay. Leyla, I notice you're getting better and better reading these commercials. Like, you really nailed it that time. Good job.
No stammer. Little stammer.
Okay. All right. So until next week, folks across the country, stay cool. Happy Independence Day. Coming up soon. We'll be here with you in spite of the holidays, and stay safe and
hydrate.
Right.
In this very warm weather. Yes.
Right. And don't light any M80s, please.
Don't do that.
All right.
Thank you, everybody.
Take care. I'm Dr. Robin Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.